Hey everyone, Dr. Kevin Leach here. Welcome to another episode of the Upper Cervical Chiropractic Research Show. If you are interested in neurodegenerative conditions, if you're a doctor who treats these conditions, if you know someone with these conditions, this video is definitely for you. Okay, welcome back everyone to Upper Cervical Chiropractic Research Show. This is episode number 4. I'm Dr. Kevin Leach, and I'm here once again with Dr. Tyler Evans. How are you, sir?
I am well. Good to see you, sir.
Good to see you, my friend. This paper is titled The Role of the Craniocervical Junction in Craniospinal Hydrodynamics and Neurodegenerative Conditions by Michael F. Flanagan, published in Neurology Research International. If you're interested in neurodegenerative conditions, if you know someone with neurodegenerative conditions, if you treat patients with these conditions, or if you or someone you know is suffering from these neurological conditions like migraine, seizure, mood disorders, and a host of other health issues, this episode is definitely for you. So, Dr. Evans, before we get into discussion about it, can you give us a 50,000-foot overview of the paper and maybe explain the title, because there's some big words in there, and explain what their goals were?
Yeah, absolutely. I think it's important that you understand who wrote this paper. So Michael Flanagan is a chiropractor that graduated from Sherman Chiropractic College in 1978. He produced a handful of papers. This was the biggest one, and it came out in 2015, I believe. Yeah, 2015. Before that, in 2010, he produced this book, The Downside of Upright Posture. If that's visible there, you know, if you can see it on the YouTube video, if you're interested, it's called The Downside of Upright Posture, the Anatomical Causes of Alzheimer's, Parkinson's, and Multiple Sclerosis. Now, this paper is a little more of an advancement of that book, and it moves forward from the concepts he presented in his book. It's an overview of the craniocervical junction, which is the base of the skull, C1 and C2, and its contents, and why its contents are so important in terms of the fluid flow. So craniospinal hydrodynamics. There's a lot of big words there, right? A lot of big words. Okay. So the craniospinal part is the junction between the neck and the head, right? That's where we upper cervical chiropractors live. That's what we do, is we correct misalignments of that craniocervical junction or upper cervical spine, being C1, C2, underneath the base of the skull there. And he discusses in this paper the importance of this because of the intense emphasis that's placed on that area by the human body. Because when we stood upright in gravity, the human body had to develop compensation mechanisms for the weight of the head, which is roughly 10 to 15 pounds based on the person, being directly over the spine. Now, that wasn't that way before in primates. And so there is a new method of movement of fluid in and out of the brain. That's part of what makes us special as humans, is our big brain and our skull, and the pressure cooker of the fluid that's got to get in and out of that skull all the time, every minute, every second. And if it doesn't, the brain doesn't work right, the body doesn't work right. And so that's where this hydrodynamics comes into play, of the craniospinal hydrodynamics. And lastly, the neurodegenerative portion. So neurodegenerative diseases are diseases like he lists in The Downside of Upright Posture. They are Alzheimer's, Parkinson's, multiple sclerosis. There are other ones. ALS is another one, Lou Gehrig's disease. So it's a breakdown on his take, and a breakdown of the literature in a narrative review from a 30,000-foot view of what he accumulated in knowledge over his lifetime. And unfortunately, this paper came out in 2015. This is his magnum opus. He passed away in 2016. So, you know, we were sad to lose him in the upper cervical community, because he really was a visionary and a shining light, and really helped, you know, guide the research for these neurodegenerative disorders. So There's a lot to unpack here, but that's kind of the 30,000 foot view.
Tyler, would you explain, because the paper goes through, malformations and misalignments in the craniocervical junction, in the CCJ, right where the head meets the neck, and how that can affect the hydrodynamics, which is the cerebrospinal fluid flow, and blood flow in and out of the skull. Can you maybe just talk about how we as upper cervical chiropractors would be helping that, and why that a misalignment in that area would be detrimental to the health and in the short term and the long term?
Sure. Well, first thing we can do is just read the kind of abstract at the start of the paper here. The craniocervical junction is a potential choke point for craniospinal hydrodynamics and may play a causative or contributory role in the pathogenesis, so the creation of pathognomonic or pathological problems, and progression of neurodegenerative diseases such as Alzheimer's, Parkinson's, migraines, seizures, silent strokes, affective disorders, schizophrenia, and psychosis. The purpose of this paper is to provide an overview of the critical role of the CCJ in craniospinal hydrodynamics and to stimulate further research that may lead to new approaches for the prevention and treatment of the above neurodegenerative neurological conditions. So why the upper neck might be a potential choke point is that it's a small narrowing where everything has got to go down and get back up. And if it's, we can put it very simply. It's like a plumber, if the pipes are not lined up right, the fluid doesn't flow right. And the head is an extreme case of sensitivity to pressure. And the rest of the body is as well. The spinal cord, the dura, the fluid that flows around it, it's got to be just right. And, you see it in anytime we have a dural leak in the spinal cord, I mean, immediately or most of the time, fairly quickly, there are some negative impacts because the fluid has to be balanced between the cerebrospinal fluid, which is the clear liquid that flows around the brain and the spinal cord, between the dura and the core and the tissue, to protect it, to bring nutrients to it and away from it. And then the arteries and the veins, which bring oxygen to the brain, bring oxygen to the tissues, and then take away the toxic waste as well. And there's a boundary and a barrier between them, but that boundary and barrier is it's can be altered by the changes in the cervical spine. So when we see changes in where the cervical spine is rotated to, if there's misalignment in C1 or C2, we see this, and you can see it in Dr. Rosa's work and the upright MRI work, pre and post CSF flow changes. It's been documented. It's in PubMed. These changes in how the brain works, it starts to break down the tissue, and the malformations do it as well. So, there's basilar invagination, there's Chiari, there's a whole list of them. Yeah. And those start to create neurological detriment to the brain, because the brain can't function well when the fluid is not flowing around it properly. So does that get us headed in a good direction there?
It does. And I think it's really important, and it's interesting to think about. You said that the pressure, it's like the pressure inside the brain, right? So that cerebrospinal fluid, and if we can think about the head and the spine, it's almost like it's encapsulated, and that's where the cerebrospinal fluid flow is. And so when we think about normal blood pressure, it's not only do we need normal blood pressure in the body, but the blood pressure affects inside the skull and the spine, and the CSF actually, that pressure. So it's almost two pressures need to be regulated inside the skull and inside the spine, which blood pressure affects and cerebrospinal fluid flow affects, which a misalignment in the upper neck, which we deal with and we correct all day, every day, can actually affect these flows, and it can create problems like these neurological conditions that we just mentioned, and if left long term, can start to develop and contribute to these neurodegenerative disorders. I like the idea, your analogy to the plumbing. If you think, just for the listeners, just to get an idea for an analogy here, if you know how a faucet works, if you can imagine, for there to be proper flow, the faucet is all the way on. A misalignment, malformation, or something obstructing that flow would be if you just turn that faucet maybe halfway off, or a little bit off, or a lot off. It restricts that flow. That's what the misalignment in the top of the neck is doing to that cerebrospinal fluid flow, and potentially to that secondary venous outflow, which can, again, create a host of problems. It was interesting when I was looking in here, I was trying to find it in my notes, all 5 of the different ways that a misalignment and malformations can affect the health of the body. So I always talk to my patients about a cascade effect of what happens. Patients say, oh, well, I have headaches, but it happens when I'm stressed. And then I try to say, well, if I got stressed and I got headaches, maybe that would be the cause. And if every person in the world, when they got stressed, they had headaches, maybe that would be a cause. But it's an exacerbating factor. So we can think about, okay, so we have a misalignment in our spine. Well, it didn't just get there because the body was bored. We most likely had some sort of injury or something that happened that tore loose the connective tissue in the upper neck, and now we have a misalignment. That misalignment affects the hydrodynamics of the spine. That affecting and that disruption of the hydrodynamics causes five different things that they talk about in the paper. Number 1 being ischemia, which is lack of oxygen to the brain and to the spinal cord. Number 2 is edema, which is just excess fluid. You can think about kind of like an inflammation effect. Structural strains, so like pressure and stretching. So if you think about an increased or decreased pressure inside the brain and the spinal cord, you could have a stressing and a straining and a pulling of those tissues, which isn't going to be good. Number 4 is pressure waves. And you think about like a water hammer effect. Every time we've got the blood flow and the heart beating and there's these pulsating rhythms that happen with our cardiovascular system that helps the cerebrospinal fluid flow. If we have too much pressure, too little pressure, and we have this water effect that just keeps pounding on those soft tissues of the brain and spinal cord, that can create damage as well. And the 5th one is sluggish CSF flow. And that's going to cause a problem because the point of CSF, number 1, is for protecting the brain and the spinal cord. So it's almost like a cushion effect for when we move and et cetera. But it also brings nutrients and takes toxins away from the brain and the spinal cord. So if we have that sluggish CSF because of an obstruction in the craniocervical junction, that's going to decrease toxins taking away, which can cause inflammation and damage tissues and not bring enough nutrients to the brain and spinal cord so that it can just function properly in the way that it was designed to. And so when that happens, we can get immediate effects like migraines and conditions like that. And then it can also long-term cause a breakdown. So a good differentiation between a simple explanation between maybe a neurological problem and a neurodegenerative problem is neurological is going to be something that affects the nerve function, for example, a misalignment or malnutrition, et cetera. But it doesn't affect the structure and the entity of the nerve. So it doesn't break down the nerve like a neurodegenerative disease does. So the neurodegenerative disease, degenerative meaning deterioration, is actually changing the structure of the actual nerve, which can happen over time when there's things like ischemia, lack of oxygen, lack of nutrients, et cetera. So I wanted to go over that just as a basic overview of what that mechanism is doing. Any thoughts on that, Tyler?
Yeah, a couple of things. So I think it's really important to highlight how the CSF and the venous flow and the arterial flow work. So one, if you want to talk, let's first talk about the CSF. A lot of people may not even know what that is, but there is this compartment in between the spinal cord and inside of the dura that is a space that is surrounded by this clear liquid. And that clear liquid, cerebrospinal fluid, it is created deep inside of the brain in the ventricles. They're called ventricles. And these little cells, red cells, they produce the fluid deep in, like literally in the center of the brain. There's empty spaces. People don't realize this. They think your brain is this squiggly worm looking thing on the outside. No, deep inside the brain, there's actually compartments, there's different parts to it. And so what happens is this fluid is created deep inside the brain and it pushes against the tissue. And that's part of what gives the tissue its shape and size. And another thing is the brain is actually very fluid in nature. So when we think about a brain, like I know that you and I both have had neuroanatomy lab. We've dissected brains. We've done that. We've been in labs, and those brains are hard because they have been hardened by chemicals. But normally structure is quite fluid. And so this fluid coming out of it creates the structure partially, right? And so you need this very dynamic balance back and forth, right? And so it's creating this liquid and building pressure inside the brain. And that's what drives the fluid down from the center, down through the rest of the spine, like down through the upper neck, down through the rest of the spine into the thecal sac at the bottom of the spine, and then back up and around. And then it comes out through the venous system, and that fluid gets kind of absorbed into the venous system and then is circulated back out and reabsorbed and goes back through. Now, why is that important? Well, because if the upper neck is out of alignment, it literally can cut off that fluid flow. And now you've got a problem like hydrocephaly. Now you've got a problem where fluid is literally pooling on the brain. And we know there are papers, I can't remember the exact name of it right now, but I believe it's the implications of cerebrospinal fluid stasis. It's close to the name of the paper. But if you look this paper up, it talks about the detrimental effects of having cerebrospinal fluid be static. It's like a pond, right? Rather than a river. You want flow. You don't want too much flow. You don't want too little. And you don't want it pounding, like you said, a water hammer into the tissue. Right? That can be bad. And so it's really important to have this proper flow. And when we do, it takes away toxins from the brain. And when those toxins sit there in stasis, we get lesions. Okay? Multiple sclerosis means multiple lesions of the brain and spinal cord, right? And so I see it all the time, and I have neurologists that I work with, and I love them for what they do. And it's really important that we remember to have a functional perspective, because the body, it lives in a functional, we live in a functional world, right? So why are those lesions there? Where did they come from? What created them? How do we get rid of them? One way to work with that is to get that CSF to flow better. And we've seen it in Dr. Rosa's papers. They're in PubMed, where lesions decrease over time because we're helping that fluid flow better. Go ahead.
I was just going to ask, I think that paper is important. Does he have one that shows
Yes.
the...
He has a paper. It's in Craniocervical Syndrome, an MRI book, as well as he just put one in the interlocking, I forget what it's called, something or other. It's a paper that he produced last year or 2 years ago. We can get that up.
Got it. Well, my question was, what's the thought process right now, because this was several years ago, on those plaques with multiple sclerosis being demyelination as opposed to maybe an inflammatory effect that comes up on MRIs?
Yeah, it's inflammation, right? So I can't be quoted on that right now because I don't know exactly the nature of the lesion, but I do know that they result from fluid sitting there. That's in that stasis paper that I was talking about.
And we say that like, oh yeah, it's inflammation, but in the world, they believe it's demyelination. I mean, wouldn't that be
Well, yeah, and that's so it's like demyelination is the downstream effect of those lesions.
Got it. So
Right.
there's an inflammatory effect first.
There's an inflammatory process happening, and it
Got it.
attacks. So the body attacks it. There's
Got it.
inflammation. The body's attacking it, and maybe it's chicken or the egg, right? So like, which happens first?
Okay.
So that's probably the struggle right now. Is like, well, what's happening first? Most of the literature in the past was on the neurological demyelination because it's studyable. You know, you can study that.
Okay.
So
okay.
Yeah.
So just to be clear, the Scott Rosa, would he say that because of the stasis of the CSF, the lack of flow, lack of toxins being pulled away, creates an inflammatory process? That inflammatory process attacks the myelin on the nerves, which then demyelinates the nerves, which then causes symptoms of multiple sclerosis. Would that be?
Let's not put that on Scott Rosa, but I'll take that one.
You'll
I'll
take
say
it.
that
Okay.
that's what I've pieced together over the years.
Okay.
I'm not going to put that on Scott Rosa because I'm not
Fair
sure
Fair
what
enough.
he said in the past, but I know that he has
for him.
shown, right, exactly. I know that he has shown pre and post changes in the sclerosis lesions and symptomatic changes, right?
Yeah.
So.
Well, let's review a paper on that because I know he's got some imaging where,
Oh, yeah.
And it's pre and post, isn't it? Pre and post
Yes.
adjustment where
Yep.
he sees that CSF flow decreased and then does it again. What's the imaging that is that a functional MRI? What are the?
That is an upright MRI.
Okay.
Those are created by Ray Damadian, and I'm looking up the name of the paper right now, but it is the possible role of craniocervical trauma and abnormal CSF hydrodynamics, there's that big word again,
Right.
in the genesis of multiple sclerosis.
Got it.
So we can do that paper in the future, but
yeah, let's do that for sure.
Yeah, it breaks it down in here. I'm not going to get into it right now but let's focus on this because there's a couple more layers to this. But that first piece, so CSF, got to have it move right. Can't be too slow, can't be too fast. Got to be moving in the right ways, in the right places. If it's not, it starts to wear down the tissues. It'll actually eat away bone, right? Like, not eat away, but it wears it off. You know, it's like it's not good to have it wearing like that, right? So the other parts to this are the arterial and venous flow. So the arterial flow, we have 80% roughly goes through the carotid arteries, and 20% goes up through the vertebral arteries. So we know that 20% of what feeds the brain, now which part of the brain is the important question. When we talk about the spine, 20% of the arterial fluid flow to the brain goes through the spine, through the vertebral arteries, right through C1 and C2, right literally through them. It kind of torques around and then comes back up and goes right up through the top of the skull, or right through the base of the skull, the foramen magnum. And when it does, it comes together at the brainstem. What does the brainstem control? It has cranial nerves. It has the functions of, digestion, heart rate, breathing, immune function, you name it. All that is controlled in that area. So if we don't have the proper fluid flow up to the brain, which brings oxygen and nutrients, we're in trouble, right? And so if C1 is rotated, C2 is rotated, it's going to affect how that fluid is flowing up into the brain. And that's documented in PubMed as well. I don't have the names of the papers here, but that is very well documented in PubMed when we have torquing of the arteries around the vertebra, and it slows down the fluid flow up in one side. So that's pretty well documented. And if I can, just the last piece here is the venous flow. So it's really important to understand the venous flow. So the venous flow out of the brain is another magical variable piece here, that if it's not just right, we get problems. And it's called cerebrospinal venous insufficiency, CCSVI, cerebrospinal venous insufficiency. And so that is a whole nother topic and a whole nother problem, but that's part of what he's talking about in here, is having the fluid come out of the head the proper venous drainage. And when we talk about positioning, we talk about that evolutionary adaptation to standing upright in gravity. Well, when we are in gravity, the preferred way that venous blood flow leaves the skull and goes through down through the neck is right through the vertebral venous plexus. And that vertebral venous plexus travels right through the spine. It literally wraps, and it's like a vine that's wrapped around the vertebral bodies, right? And so if you have misalignments in the vertebra, you're going to have trouble there, right? And we know that, so that's upright in gravity. When you're laying down, the preferred method of travel is through the internal jugular veins. So most people would think the larger vein would be the place normally that the blood flow goes out of. Well, no, that's not exactly true. And so why does it do that? Well, because there's got to be that right balance of fluid going up. You can't just have all the fluid rushing out of the head. There's got to be some pressure to keep it up there. And that's what that does, is it slows it down coming down through the spine. But if you got a misalignment at C1 and C2, you're in trouble, right? You got fluid flow back up into the brain.
One of the points that I wrote down, we learn as chiropractors that we're turning on that nervous system, right? We're turning the power on.
Yeah.
You know, we're restoring the nervous system back to its proper function. But when we look at a paper like this and we look at the evidence of when we're making that, I just got goosebumps when we make that adjustment, how many different things we're affecting besides, not just pressure on nerve, pressure off nerve, or even afferentation, disafferentation of the joints, but how much we're affecting with the health and the implications that can have on our health, besides just mechanically in a biomechanical correction of the musculoskeletal system and the neuromusculoskeletal system. We think of ourselves chiropractors as neuromusculoskeletal doctors, right? We evaluate chiropractic subluxations and we correct chiropractic subluxation. What we're affecting is just tremendous, and who knows what we've helped. When a patient comes in with headaches or whatever, pain, or they came in from a car accident or whatever they came in for. I mean, we correct that spine, we correct that upper cervical spine, the Craniocervical Junction. What else are we helping that they're not really even feeling yet, or some sort of underlying process that they're not even understanding what's going on, and how many different that craniocervical connection off or obstructing it. Like, where are those problems going to manifest in the brain for that particular person? It's just incredible to know the depth of what we're doing without even knowing we're actually doing it.
Oh, absolutely. And it's a very good argument for preventative corrections, preventative alignment to prevent neurodegenerative disorders of the brain.
Yes.
The thing that drives the body from day one to the end.
Yeah.
The thing that's literally keeping you alive. We are helping the fluid balance.
Yeah.
So that it is, getting nutrients in and out, and is properly keeping buoyancy in the brain, protecting that tissue. I mean, it's unfathomable how many things could be connected to it. And this is about brain health. What we do is about brain health. Yeah, we can talk about the spine. I mean, yes, we're adjusting the spine, but this is happening in the brain.
Mm-hmm.
All of this happens in the brain. So it's just really important to connect with that. And there's papers that, obviously when we do adjustments, it affects the neurology in the brain, but the fluid flow is just as important, because the nerves don't work unless there is stimulation, oxygen, and nutrients, right? So stimulation, that's one part of it, but oxygen and nutrients coming from the fluid, that's also where we live. So, yeah.
Absolutely. And obviously, Dr. Flanagan, in the conclusion, he'll talk about, we'd like to see more research done,
yes,
et cetera, which, even though a lot of times with research, it paints a pretty clear picture and we can come to our conclusions, but more research obviously is better and is necessary, especially for other professions, to not just take our word for it, but to see some evidence. Dr. Scott Rosa, I'm sure, is doing great research. I'm just hoping more research comes out like this that can really show what we can do to help that. And again, it's important that our listeners and viewers understand we're not saying that, come to us and we're going to cure your Alzheimer. You know what I mean? Like,
No.
it's not. But the fact is that this is the way I look at it. There's evidence, and there needs to be more research to show that and prove that evidence that we have a role to play with these conditions. Now, meaning someone starts to have symptoms like multiple sclerosis. Maybe they don't have plaques show up on their MRI. Maybe they're not actually diagnosed with that. As a conservative approach and as a box on that list of, hey, you've got these problems, you need to go get your neck checked out. Maybe they need to get an MRI to make sure there's not a tumor or a malformation or something else serious going on. But a lot of times, and I know you can relate to this, is we see patients after they've been to the medical doctor, after they've had their exams, they come into our office and they say, I've been everywhere. You're either my last hope or you're my next step, right? So it's important that we get to a point in the healthcare system where doctors, neurologists, that they know that we're on the list for getting screened for an upper cervical misalignment, a misalignment in the Craniocervical Junction. Huge. It's got to be, for our patients, it's got to be a check mark on that list. Mm-hmm. Any other points or takeaways or last discussion points here?
I think we covered it pretty well. I mean, it's a huge paper. It's 257, I think, references. This is a beautiful paper. Like I said, it was his magnum opus. Unfortunately, he passed away a few years ago, but this guy really laid it out. And also, check out his book, Downside of Upright Posture. It really goes, it goes into the nooks and crannies of everything that he could find on fluid flow in the brain. But it's just important to have that neck checked for prevention and for, just overall health care, helping the body work better. So
got it.
That's what I got.
Awesome. But as usual, our listeners, viewers, give us feedback, like, subscribe, and all that stuff with social media, wherever you see this video, or if you're listening to the podcast, any sort of feedback and support is appreciated. We're trying to help people. We're trying to bring value. And that's about it. Anything else, Tyler?
Thanks again, Dr. Leach.
Awesome. All right. Thank you for watching, listening, etc. Take care.